And as COVID-19 restrictions start to ease, new data is shedding a light on the most vulnerable affected by the pandemic. Recent reports reveal minority patients in long-term care facilities had higher mortality rates than white counterparts. Our Ashli Lincoln talked with one nursing home advocate breaking down why this is.
When I deal with a problem in a nursing home, I have the law in my hand.
Cheryl Wilson, a long-term facility patient advocate, has been watching out and fighting for patients for more than 20 years. She represents families who have loved ones living in long-term care facilities.
I run about 70 families.
With coronavirus restrictions being eased, Wilson says she and many advocates are seeing increasing caseloads after a year of being separated to pandemic restrictions. She says families are finally able to see relatives and want help for loved ones, concerned over what has and has not been addressed by facilities.
We need to learn from this to be proactive.
Studies released by the Illinois Department of Health Care and Family Services and American Medical Association reveal minority patients have higher death rates and COVID-19 contraction rates in nursing facilities. One study noted facilities where more than 40% of residents were minorities. They reported 3.3 times as many COVID-19 deaths as nursing homes with fewer minorities. One issue is how fast the virus spreads in areas of minority populations.
I mean, this pandemic, it came out of nowhere. We were no more prepared for this than the man in the moon.
The study says several factors fuel the issues. One is the facility size. Another, how trained staff is. Other factors, biases, stereotyping, and clinical uncertainty contributing to disparities.
They didn't even say that something was wrong with my brother. And that's inexcusable.
News 4 has been following concerns over care facilities for the last year and how COVID outbreaks were handled.
I called the nursing facility to let them know, did you all know that he, first of all, tested positive, and second of all, did you all have any more cases going on? And we didn't know as the family. They told me they didn't have any cases.
Wilson says with this new data, she's urging facilities to learn.
Now that this has happened, I hope we can look back at what went on and how unprepared we were. You can't argue facts.
Ashli Lincoln, News 4.
Missouri's legislature passed a COVID liability bill protecting many businesses from COVID-related lawsuits. It is possible many care facilities will fall under that new bill. In Illinois, lawmakers are talking about legislation that would require virtual forms of communication for long-term care residents during periods of isolation in the future, so any issues concerning residents could be addressed faster.